Hello, today is Tuesday, April 20th of 2021. My name is Evan Solis. I'm interviewing Karla Sierra for the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Sierra, that this interview will be placed in the Nettie Lee Benson Latin American Collection at UT Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. Because we are not conducting this interview in person, I need to record you consenting. So I'll ask you a series of 5 questions. Please say, yes, I agree, or no, I do not agree after each one. There are 3 questions we need to make sure you agree to before we go on. 1, Voces wishes to archive your interview along with any other photographs and other documentation at the Benson Library at UT Austin. We will retain copyright of the interview and any other materials you donate to Voces. Do you give Voces consent to archive your interview and your materials at the Benson Library?
Yes, I agree.
Thank you. Do you grant Voces copyright over the interview and any material you provide?
Yes, I agree.
Thank you. Do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Fantastic. Next, 2 more questions. We have many questions in a pre-interview form that you and I have already filled out. We use that information from the pre-interview form to help in research. That entire form is kept in a secure Voces server. Before we send it to the Benson, we would have stripped out any contact information for yourself or family members, so that will not be part of your public file. Your public file will only be accessible at the Benson Library. Do you wish for us to share the rest of your interview, that is that pre-interview form, in your public file available to researchers at the Benson?
Yes, I agree.
Yeah, thank you. And then on occasion, Voces receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes, I agree.
Okay, all right, and that's it. Well, thank you, Karla. That's all the legal aspect of it. So to get into it, as you know, this is for our Voces of the Pandemic collection. And so the first question, the first section of this interview, I'd like to focus on your experiences here during the pandemic and the experiences of your community. So can you, if you reflect on now over a year ago when all this was beginning, is there a moment that sticks out in your mind, an experience you had or something that you saw or heard when you realized that this pandemic was going to be a serious issue for some time? Anything stick out in your memory?
Probably the last celebration that we had with my family. It seemed like people were getting more and more worried about how the pandemic was going to pan out. And so we celebrated my brother's birthday last year in March, and that's right before everything, started happening, kind of all the chaos with people going out and buying water. I mean, I remember going to the store and there was no more bottled water, like no more toilet paper, which we thought was kind of strange that everyone was buying a lot of toilet paper. But I mean, I just remember it being just kind of chaos, like at stores and parking lots, and people were really terrified about how this was going to pan out and how long it was going to last. And so that was during that time I was certainly traveling with LIBRE. I mean, we obviously are all over the country, and so we would travel to different events and things like that. And so little by little, they were starting to pull back on how many in-person events we could do, like how much travel we could do, really putting restrictions. I have a lot of community outreach events here in El Paso. And at that time, we were working a lot with some local public high schools. They were about to go on spring break, and they went on spring break, and we actually never came back. So that's one of the moments that I really remember, just kind of everything just shutting down in terms of personal and professional life, about hearing about COVID, the media, all of that stuff was just very prevalent during that time a year ago.
Yeah, I think everyone has sort of similar experiences or similar memories of that time where everything's changing very quickly. And I want to talk about LIBRE, obviously in your professional work, but before I get into that, just at a personal level, how do you feel this last year has affected you? People talk about the changes affecting them financially, mental health, causing anxiety. I know that you had a family member who got sick and then recovered. Just when you reflect on this past year, what has it taken a toll on you in any way? And if so, how?
Yeah, great. I mean, great question. I'm definitely more of an extrovert. I I love my job because I'm passionate about, obviously helping the Hispanic community, but also that I'm able to be out in the public, talking to people, interacting with people, doing a lot of engagement in social events. And so it did affect me a lot personally. I mean, even on a professional level, like we had to completely shift in terms of how we were doing our work. And I'm sure we'll talk about LIBRE later. In terms of myself and like personally, Hispanics are a very tight knit community just in general. I mean, sometimes people joke about us and they're like, gosh, you guys do everything together. And I'm like, yeah, we even go to the restroom together. Like we can't do anything by ourselves, So that was a huge change for me, especially because that's just how we grew up. I mean, our families were always very close, like our cousins and our tios and tias and abuelitos were always with us, whether it was in our home or going out to eat or doing something together. So that was really kind of detrimental for me because we didn't have that interaction anymore, even with friends. I mean, I'm from El Paso, so I do have a lot of really close friends here. We weren't able to do the same things that we used to do. I was married. I mean, I'm still married to my spouse. She works in the medical field. And so she was seeing a lot more, things relating to COVID, like how it was affecting people more so than I was in my profession. And so we both had very different perspectives in terms of how we wanted to handle and kind of maneuver through COVID. We also had a baby. I mean, our daughter was, she was about to turn a year old in April. And so there was certainly a lot of worry and concern trying to figure out and maneuver to see how we were going to get through this kind of like very strange time. Mentally, I mean, it was extremely exhausting. With work, it was Zoom calls, Microsoft team calls, like every day, almost all day long. That was extremely exhausting. Working from home, my wife was actually furloughed for about 6 months. And so the financial part of that was something also we had to maneuver in addition to, COVID and having a toddler in our home and working from home and trying to manage through that. So it was certainly difficult for us. I mean, we definitely try to be creative in terms of how we were trying to get through all that, making sure that we were trying to interact with our family and friends in other ways, like, FaceTime was huge, making sure that we coordinated like birthday Zoom calls or something for family members. So we did try to incorporate some of those creative things. Obviously, it didn't alleviate like us not being to physically be with our loved ones, but it helped a little bit and it helped us get through a little bit. Definitely watched a lot of Netflix and movies and read a lot of books and things like that. But it was also a blessing in disguise because my wife and I we're very career oriented and we love our jobs. I love working for Libre. She loves being a physical therapist. And so both of those jobs are very demanding. And for us to be able to be home with our daughter for a year, almost a year. I mean, that was a blessing. So we were certainly trying to be optimistic and taking everything with a grain of salt and saying, most people aren't able to do this. Like most people have their children like in daycare or with an abuelita or abuelito or something. And we were very fortunate to be able to kind of see her grow up during that time, even though it wasn't ideal, obviously. I mean, we wish that our family could have seen her grow as well in person. But for us, it was really something that helped us be hopeful that things were going to get better.
So your daughter, is she at an age where you feel this has affected her development in any way, or is she still young enough where maybe the socialization, she's not really entered that phase yet? Because what do you think this year has meant for your daughter's development?
Yeah, I mean, I was really concerned about that. Like I mentioned earlier, I mean, we had different perspectives on how we felt about COVID. I was more lenient and more open to like different ideas that were out there. Especially working with Libre, we hear a lot of different things, like a lot of different chatter in terms of what it really is, like who it's really going to affect. And in my perspective, children were never really affected as adults were, or adults with pre-existing conditions. And so that was my take, that, there really aren't a lot of numbers out there that where children are being affected, and it wasn't really something that was supposed to affect children in the first place. And so that was my perspective. I was a little bit more open to that. Like, I was like, I really want to see my parents. Like, I really want them to see my daughter. And she wasn't really, like, she was very, I kind of called her the warden, because it was like, we can't do this, like, wash your hands, we can't do that. And so we did have like varying perspectives on that. And so when it came to my daughter, it was the same thing. I mean, she didn't have like physical contact with anybody for probably the first 8 months. And so, I was worried about that, because I'm all about being social and being kind of out there and interacting with people. And she's a little bit more reserved than I am. And so I was very nervous about that. Little by little, we started incorporating people into her lives, like people that had been safe and not really going out and things like that. So we kind of found a balance, and, they would come to our home and watch her for a few hours, or spend a few hours with her outside or something like that. But recently, as our family members and friends have been getting vaccinated, my wife has been feeling a lot more comfortable in terms of having our daughter interact with them, and, hugging her and holding her and things like that. And so over the last, probably, I would say, like, last month and a half to 2 months, we've been incorporating that more in her life, like making sure we're going over to, hang out with our family members that have been vaccinated. And she surprisingly has adjusted, like, very well. I mean, she, just like any almost 2-year-old, she's a little bit shy at first, and then she has to warm up to people. And after that, she's completely fine. I mean, she has, it's like COVID never happened with her. I mean, she doesn't really know what's going on. We have been incorporating the mask with her, just because we're not sure yet, but, we'll take her to, like a tea place or something, and we're like, well, you have to wear your mask, if you want to come with us. And she understands, like, what it is, but she really doesn't know why. And so, I mean, understandably, because she's 2 years old, but she understands that, if we go outside, or if we go inside a store or something, she has to wear a mask. And she's really good about it. I mean, if it's longer than like 35 minutes, she's ready to take it off, which I understand, because I am too. But for the most part, I mean, we took her to like Costco last weekend, and there were toddlers and like babies in the store, and she wanted to hug them. Like, she would say hi, and like she wanted to hug them. So, I mean, for me, like, that was great, because I was really nervous about that. But it's also kind of sad, because, we're like, no, you can't hug them. Like, you can't touch them yet, so it's like how do we can't really explain that to her. We just have to kind of like pull her back. And I'm really hopeful that things will get back to normal. She's going to start school in the fall for a couple of days a week. And so I think that that's going to really be even more helpful for her, is to just interact with other kids. And but yeah, it seemed like it didn't really faze her that much, because she was so small. I think if she would have been a little bit older, maybe like 5 or 6, I think it would have been definitely more detrimental in terms of whether it's mental health, or kind of, not being able to interact with people socially like she had before. But I think because it was kind of at the right age, I guess, she didn't really notice what was going on. So that's kind of what we've gone through, like, this past year in terms of her development.
Yeah, got to be very strange for her, right? You wonder what she'll remember years down the line. I wonder if any of it will stick with her.
Exactly. Yeah.
What about your older family members? So I know your parents live there in El Paso as well. I don't know about your wife's family, if they're in that area, or just if over this year, if y'all have been worried about them in particular, or how long was it before? How long of a time did y'all go without seeing each other personally? Like, what has your relation been like with older members of your family over the past year or so?
So, excuse me. So my paternal grandparents are still with us. Thank goodness they live here. We were very worried about them. I mean, they don't have a lot of underlying conditions, where they have more of things like knee surgeries and hip surgeries and things like that. But in terms of like heart conditions or diabetes, they don't have that. And so I was still concerned about them because a lot of people would go to visit them, and they have, care providers that go over every single day. It's like 2 or 3 per day that would go and take care of them throughout the day. And so we still kind of stayed away from them. And one of the main reasons was because my spouse was working in the medical field, and she was with people, I mean, literally like 10-hour days, like at her clinic. And so we were more concerned with that, just because in the early months, we really didn't know like how it could be spread. Like if we would spread it, like, we're still kind of worried about that. And I mean, my grandparents, they're already in their 90s. And so for us to put them at jeopardy just because we wanted to go see them, or kind of be stubborn about that, I was like, let's just stay away. We'll continue to call them, and then we'll go from there. My wife's her maternal grandmother is still with us as well. She's about in her 80s, and so my wife she did not want to go over there. I mean, she was so terrified that something would happen that she was like, I'll just call them, we'll FaceTime them, like we'll do whatever we can, but we're just going to stay away until we know a little bit more, things calm down, or whatever the case may be. So I know that was really difficult for my wife and her grandma, because I mean, they're actually extremely close. And so, we just were kind of nervous about that. So we didn't see them for months. It was over six months that we actually didn't go over there and visit them. But other than that, I mean, it was just kind of like her and I and our daughter here in her home, and that's about it. I was the one that primarily went out and purchased, groceries or whatever we needed, and they would stay home. And so, I mean, though, like just with those 3 grandparents, I mean, we were just really nervous about what would happen. And so we were also taking precautions as well, in terms of making sure that their caretakers were wearing masks, or because they would also go to other people's homes, and then they would come back to my grandparents' home and watch them. And so you can't really control what other people are doing or what their perspectives are about COVID. We don't know like what they're doing like in their personal life, if they're going out and doing things. I mean, and it's not that I had anything against that. It was just that there were so many factors that played into this pandemic that were out of our control. We could wash our hands, we could wear a mask, we could stay home and quarantine. But we couldn't control what other people were doing. And I think that's what really, that's really kind of terrified my wife, is that she was like, well, we don't know what other people are doing. And she has a point. But with me, it was like, well, I mean, we can't live like this for the rest of our lives. At some point we need to, get back to normal. And so, I mean, little by little we are, but in the beginning, we were really worried about our grandparents and infecting them. And just because of, obviously the media, all this horror stories that we heard about elderly people that were going into the hospital and not coming back out. And I mean, that was just something that we didn't want to risk. And so we didn't. We just kind of stayed away and just kept in communication through phone calls and things like that.
You had mentioned that a family member of yours had gotten sick and recovered from COVID. What was that experience like? Was it serious? Is it someone you're close with? What was it like for you?
Yes, that was extremely scary. It was actually my aunt on my mom's side, and like I mentioned earlier, we're all pretty close. She's an aunt that lives here. Unfortunately, all her children live in San Antonio, and so she's here with my uncle. And so she actually does have underlying issues. She has asthma, and she's always had just health in general with allergies and blood clots. And I believe she has a heart murmur and things like that. So there were some underlying issues that she already had. She's a teacher, so she was primarily working from home, which was great. However, my uncle actually was an essential worker. He worked at a grocery store, and so we really don't know for sure, but it is possible that he brought that back from work just because he's exposed to more people all day. And so he had it first, and then she got it, a few weeks after that. And so we we're all extremely worried because she was being extremely careful out of everyone. I mean, she wouldn't go out, like she would, have her groceries delivered, no restaurants. She would wear latex gloves, like if she had to go somewhere. I mean, she was also very worried that she would get it just because of her underlying conditions. And so, I had heard about, the cocktail that people were taking that had COVID, where, it was an IV that would help them kind of, it would run through their system a little bit quicker. So I recommended that to her. I said, I heard about this. I don't know if it's going to work, but it's worth a try just because you have underlying issues and we don't want it to get worse. And so she saw her doctor, and the doctor, said, well, actually, yeah, you are a candidate for this. And so they tried it, and she did feel a lot better. I don't remember what the name of the medication is or what they put in the IV, but the doctor did recommend that this would be a good course of action based on her medical history. And fortunately, thank goodness that she's okay, like she's recovered. She did get her vaccine, her vaccine, like within the last month, where she got both doses. And so her first dose, she said that it hit her pretty hard. And that's kind of what the statistics are saying, is that if you've already had COVID, a lot of people are feeling the effects more during their first vaccine. And she did. She got every single symptom that they said you might get. So, but she's recovered since then, and we're all extremely thankful. And it definitely was difficult because, her children, but, 2 daughters in San Antonio and then 1 son in Connecticut. And they were helpless. They couldn't fly home. They couldn't do anything. And so that was really difficult for the family. But we're so glad that she was able to recover and that she got through that, because that's certainly not something that any family wants to go through anytime, but especially when there are things like a pandemic going on where you can't be with your family and do whatever you can to support them or help them. You feel helpless because it's like, gosh, what can I do? Like, I'll order you food, or I'll send you food, or whatever you all need, but we can't physically be there with them, like in that moment. So that was definitely difficult for our family.
I'm glad she recovered.
Yes, us too. Thank you.
Yeah. So you've mentioned a couple of times how there are different, perspectives on COVID, different attitudes that exist out there. And I know that since you are involved in politics or political sort of organizing and engagement, at least the civic engagement aspect of what politics can be, I want to ask you your opinion on just the different responses here both at the state level and there in El Paso. So we know that past year we've seen really fragmented responses, just depending where you live, mask mandates or shutdowns, or just different sort of reactions and policies in response to this virus have been different. So just, from your perspective, what can you describe sort of what the policies were, and specifically in El Paso related to the virus? And then what do you think just worked, or what do you think did not work? What do you think went well or did not go well, both at the state level and there in El Paso at your local level?
Yeah, great question. So politically here in El Paso, we're certainly navy blue. That's just kind of the political spectrum here. Almost 90, I want to say like 95% of people here are Democrats. There's very, very little engagement in terms of like the Republican Party. I mean, we have, the Republican Women's of El Paso and things like that. But Democrats and Democratic views are very prevalent here in El Paso. And so most businesses here did incorporate the mask mandate. So if you were not wearing a mask, you could not enter, the business or wherever you're trying to go. And I mean, yeah, there was definitely some people here who did not agree with that. And part of that could have been, it's my decision. If I get COVID, that's on me. I don't want to wear a mask. But also, I think the second part was, why should the government or my local legislators tell me what I need to do? There was a lot of controversy when it came to the mask, even when it came to them mandating or implementing these mandates that you couldn't have a gathering of more than 5 or 6 people at a time in your home. If you did and you were caught, then they were supposed to give you a citation. That was kind of how our local legislators tried to handle that, because they knew that people were still going to want to go out, whether it was to a restaurant or a bar or even get together. Around that time, Easter was around the corner and Mother's Day and graduations. And so they knew that people were still going to want to get together regardless of whether COVID was here or not. And so they tried to, implement all these mandates that where people couldn't gather together, and the mask thing, of course, as well. But I think one of the things that was kind of controversial is that a county judge from here, his son was about to graduate, and they actually had a gathering at his home with several people. I'm not sure how that people found out, but it was on the news, and he was the one that had come on the news a couple of days ago stating that, this is what El Paso County is going to do. You have to wear masks. You can't have gatherings and things like that. So we're entrusting that our local legislators are doing the best for us to be safe, which is perfectly fine. But then when he violates what he was trying to implement a few days ago, I think that kind of, it makes people kind of wonder and say, well, why should we do this if you're not doing it? You're trying to make us do these things, but you yourself are not making sure that you and your family are incorporating the same things. So I think there was some backlash about that. So in terms of like local politics, I think that if it would have gone a different way, like if maybe they did have that party and they didn't get caught or something like that, I think people would have had more faith in like our local legislators, but that's not really what happened. So it kind of played out a different way. So definitely people were a little upset about that. It was contradictory. But for the most part here in El Paso, I think that, people, and this is kind of my perspective too, putting aside like my political perspectives or whether I think that COVID is fake or real or whatever the case may be, I do not want to take that chance. And I'm sure people in El Paso don't either. Like if they say that mask is going to prevent us from contracting COVID or passing it to somebody else or passing it to a loved one, then I'm going to be respectful of that. And so are other people in El Paso, and wear a mask. And that's kind of what I tell my colleagues as well, because in our organization, there's some people that are like, I want to wear a mask, and there's some that, well, don't tell me what to do and things like that. But for me, it's more of a respect thing. Like, if you feel more comfortable me wearing a mask and we're in the same room and we're talking and eating and things like that, then I'm going to be respectful and I'm going to wear the mask because it makes you feel more comfortable. And so that's kind of the perspective that I've taken here. In terms of like my personal life, my professional life. And then I think most El Paso residents feel the same way. In terms of like state mandates and things like that, Governor Abbott has come out kind of full force saying we want to reopen Texas, and you don't need to wear a mask and things like that. Here in El Paso, he certainly did get a lot of backlash, and and I think it's primarily because of our political demographic here. There's a lot of people that really don't agree with like his political stances and things like that, and so it turned into Governor Abbott is not keeping us safe. Like he doesn't care about us because he doesn't want people to wear a mask and things like that. And so I think that there's a lot of varying. I mean, El Paso compared to other cities in Texas, I think we're very unique in that I think in other places, the political demographic, whether you're Democrat, Republican, Libertarian, or conservative, I think other places are pretty diverse, but unfortunately in El Paso, we just don't have that here. So it's very one-sided in terms of how people view COVID and just any other kind of political issue in general. So, I think that really played a huge role in how in people's perspectives about the mask or COVID or anything else.
Yeah, and I know that despite the efforts of the local government there, that El Paso was a hotspot here earlier or last year, I suppose, at this point. And just speaking with different people, organizers across the nation, and also just from what we see on the news, it seems that Latino communities in particular tend to get infected at higher rates, die at higher rates, disproportionately high rates compared to their proportion in the population. I know that El Paso has an incredibly high Latino population as it is, so maybe it's hard to sort of view by that same standard there. But have you seen that certain communities that you engage with or that you work with, certain communities have been more affected by this virus, maybe disproportionately so than others? And if so, or either you or your colleagues throughout the country, and if so, what do you think are some of the causes of that?
Here in El Paso, and just kind of the news and the statistics that we see, right? Primarily, people that have been affected are, El Paso has, I think we're like 83 or 85% Hispanic population here, so that's pretty high. And just in kind of conversing with whether it's local officials or people that work with the city or our medical professionals here that we have a great relationship with. Yes, in El Paso, the numbers for Hispanics are high in terms of people that are being affected with COVID. What we're seeing in El Paso is that most people that are passing away from COVID have had underlying conditions, like obesity was huge. And in speaking with some folks that work with the city, obviously we had very high numbers last year, and so it was extremely sad that they didn't know what to do with all the bodies because they just didn't realize how big this was going to get, specifically in El Paso. So, one of the things that they did notice when they were transporting the bodies was that most of the people that passed away, unfortunately, were obese. And that was kind of the primary cause that they saw in a lot of these folks that were passing away. Diabetes also, and then heart conditions. And so if you had any of those like three things, then unfortunately chances were that you were less likely to be able to like get through COVID in the 2 weeks that they were saying you would get through. So that's kind of what I've heard and seen and having conversations with people, is that those were kind of the top three things as to why people in El Paso specifically were being more affected. They had those three underlying conditions that were affecting them. And so, it's, and just in general, unfortunately, Hispanics, just because of all the great food that we have, and are able to eat, just those are things that really affect us. I mean, if we're eating tacos and burritos and all that stuff, and don't get me wrong, I love that stuff. But I think that's also one of the reasons why we have, in Hispanics, high rate of obesity, high rate of diabetes, high rate of heart conditions. I can tell you that my maternal grandmother, she passed away. She had 2 strokes, and then she unfortunately passed away from a heart attack. And she was heavier set than most people. And so those are some of the things that as Hispanics, like we don't talk about stuff like that, right? We're like, well, I'm not going to tell him that he should work out. Like, I'm not going to tell him to stop eating that. So I think if we could do a better job of just kind of communicating. I know it's hard to say stuff like that to a family member, but I'm sure that it could have saved a ton of lives. I mean, a ton of Hispanic lives that were affected by this because, in medical terms, they were categorized as being obese. And so I think that if we could do a better job of kind of educating people and informing them that, there are better things to eat, or maybe we should exercise, or, things like that, I think that a lot more lives could have been saved during this time. And just to add, like, by no means am I like a medical professional, but those are just some of the things that we've been kind of conversing with, like with our local partners and people that work with the city and things like that. And those are some of the things that they did mention as we're kind of going through all of this.
No, sure. And yeah, that's something I've heard before as well. Just a lot of those health conditions that are prevalent in our community and among Hispanics. What about the vaccine distribution there? Has that, so you said that members of your family have gotten vaccinated. Have you gotten vaccinated? And just what has the distribution process been like? Has it been smooth in your opinion? Is it reaching, the communities that it needs to reach? What have you seen?
I think I always joke around. I'm like, and I tell everyone, I'm like, this is literally like the Hunger Games. Like, everyone has to fend for themselves. And if you get a vaccine and you're able to sign up for one, then great. And if you don't, then, good luck to you. That's really the experience that I had here. I strongly feel that it could have been incorporated and planned out in a more strategic way, because I really think that that's how it was. I mean, people were kind of driving themselves crazy because they were either, trying to get on the website to sign up, or trying to get on the phone all day, trying to get through and register and things like that. Here in El Paso, UMC was the one that was, they would put on Twitter like once a week, okay, guys, we're going to open it up at noon on Saturday. And it's like everyone was waiting on their computers to kind of sign up. So I can imagine, with all the stress that everyone already felt with COVID, and then adding that onto them and saying, you kind of have to fend for yourself. And if you register, you register. And if you don't, better luck next time. That's kind of the feeling that I got when I was trying to register to get my vaccine. But also there wasn't really a checks and balances for it. My cousin could log in on UMC and register me, and I could go and get my vaccine on Sunday or something like that. I mean, they really didn't know how to manage the system properly, and I think that was a concern from not only myself, but family members and friends that were trying to get the vaccine. Everyone really felt desperate. In Spanish they were like desesperados, because they were like, I didn't get in, like, what do I do, where do I go? And it's like everyone is trying to figure out how to get the vaccine. And so I really feel like it was unorganized. There were, here in El Paso, I think there were probably that I can just think off the top of my head, probably four to five different websites that they wanted us to go and register, and none of the websites were communicating with each other. So you could register with the city, you could register with the county, you could register with UTEP or UMC, and it's like nobody was communicating with each other. And so I think that a lot of information, a lot of time was lost, a lot of things were falling through the cracks. So that process was definitely frustrating for myself, for my family, for a lot of people that I know. However, when I was finally able to register, and for the first time, and we went to they set it up at the Coliseum. that process seemed pretty seamless. I believe that they had students from Texas Tech that were helping just kind of make sure that everyone was, filling out the paperwork, the line was moving quickly, the nurses that were giving the shots and things like that. That process was pretty seamless. But then when it came time to like get your second vaccine, there was another issue in terms of, they said, okay, we'll call you back when it's time for your next one. And then nobody would call you. And you were like, oh gosh, like did the time already pass? Like how many more days can I wait until I get the vaccine? And so it kind of caused like another panic, right, with everyone, because we already got our first one, but we know we have to get our second one within, 21 days or whatever the date amount was. But that also was not a seamless process. I had to call UMC again and say, I already had my vaccine. I haven't heard from anyone from my second one. And they were like, oh yeah, we're sorry. We're just really busy, or, there wasn't really like a great explanation. And so that was very frustrating. So I think initially when they were trying to get everything going, they really didn't know what to do. I mean, they didn't have like a very good strategic plan in terms of like, okay, like, let's have one website and just funnel everyone to all these providers that can get their vaccine. Everyone was kind of on a different page. And so I don't know what the process is like now. I know that it's, more people are getting vaccinated in El Paso. Most of my immediate family is vaccinated. I think probably like a month ago, I think that, or maybe a little bit longer, they started using the Johnson & Johnson vaccine here. Obviously that's not going to happen anymore. But we definitely had all three vaccines available here in El Paso that I'm aware of.
Have you, either with your family or your colleagues or just anyone that you are in contact with, have you had any interactions with folks who are either hesitant or completely opposed to taking the vaccine for whatever reason? And if so, what have those conversations been like? What reasons have you encountered?
Yes, I have. So I was one of the ones that was like a little bit weary in terms of getting the vaccine right away. For me, I wanted to get the vaccine because I wanted to kind of appease my wife, and she was going to feel more comfortable if I had the vaccine, and appease my family because most of them wanted to get the vaccine. And so I wasn't necessarily in a hurry to get the vaccine. I mean, I was like, okay, well, if I can get it soon, then I'll get it when I can get it. But to them, it was more of like a sense of urgency. Like, no, you need to get it like right now. Let's register you. I'll register you. Like, I'll call. Don't worry about it. And I was like, okay, like it's fine. We'll figure it out. But I did feel like that. But I think I did it more so because, like I said, my spouse felt more comfortable that I had it. But then also, we still don't know 110% like how it's affecting children. And so I also wanted to make sure that my daughter was safe. But I guess thirdly, it's been very difficult for me to not be able to travel with my profession. I mean, like I said, I'm used to traveling like at least twice a month, going to do events, whether it's around the country or within Texas. And so I was really excited to be able to travel and to kind of get back out there and not be worried about me coming back and bringing something back to my family. And so that was definitely one of the top three reasons why I did it. My mom is actually one of the ones who did not want to get the vaccine. She was extremely hesitant. She said, why am I going to get a vaccine that they've developed over, however many months they developed it? Like, we don't know what's going to happen. Like, there's not enough testing. Like, I just don't feel comfortable. But then also too, she was kind of like, well, why are they making us get it if we don't want to get it? Right. Like the whole kind of coming back to mandating us to wear the mask thing. Right. Well, she was kind of like, well, if I don't want to get it, why should I get it? And excuse me. And she has a really great point, because these are conversations that I've had with other family members. Same thing with the chickenpox vaccine or the flu vaccine. I mean, even before COVID, we never knew who had gotten their flu vaccine and who did not, right? We could have been eating at a restaurant, we could have been in the same airplane, and we were not going around asking people, oh, by the way, did you get your flu shot? It was just kind of life. We just kind of went through life like assuming the best of everybody. But like I mentioned earlier, we can't control what other people do. If they don't want to get their vaccine, then that's their prerogative, and we can't mandate people to get the vaccine just because of our beliefs or our religious or political or any other kind of belief that we might have. And so my mom was definitely one of those people that she did not want to get the vaccine and she didn't feel comfortable. But I think what kind of pushed it over the edge was that, we as parents, like anyone, we were obviously very protective of our children. And I was like, look, like we just feel more comfortable if Chloe's going to be around other people, that she's around people that have gotten the vaccine. And I said, and, unfortunately, like she can't get a vaccine. Like, we don't know if they're going to give children a vaccine. Like, we just don't know. We don't know what other way we can protect her unless the people around her are actually vaccinated. And so that was definitely a difficult conversation, not just with my mom, but with other family members who are wanting to be around our daughter, to say, look, like this is kind of, as parents, like our stance. And if you don't agree with it, that's fine. But that's kind of how we feel right now, just because there's so many unknowns. And so those are definitely difficult conversations, but I mean, I completely understand where they're coming from. There really isn't a lot of scientific data to say that this is going to protect us 110%. And depending on which version of the vaccine you got, we are going to have to continue to get vaccinated. It's not like, it's a one-shot deal and okay, you guys are fine. And now everything that's coming out with, Johnson and Johnson about the blood clots and things like that, I think that's certainly making people feel more concerned as well. And so that's definitely not helping the situation in terms of wanting to get more people on board and wanting more people to get vaccinated. That actually, kind of detracted what they're trying to do, because if people had concerns and were, worries about the effects of the vaccines before the Johnson and Johnson thing happened, I think that now they're probably going to have more doubts and more questions and more resistance to want to actually get, vaccinated.
And just to be clear, because this interview may be viewed a long time down the line, the blood clots you're referring to, those are they've been linked to some Johnson & Johnson vaccines, and I think folks are having strokes. Is that right? What? Yeah. Mm-hmm.
Yes, I believe so. I believe it's stroke. Yeah, so blood clots and then strokes is what I've heard. So I'm not sure what else they're causing, but yes, so I guess they're pulling everything back on that particular vaccine.
Mm-hmm. Oh, well, I want to sort of pivot and go more towards the political sort of aspect of your life, your professional life, your work with civic engagement and working with the Hispanic community. And I just want to start with you at a personal level. When I asked you in the pre-interview what your political identity had been as a young adult, you said Democrat. Obviously, you're in navy blue, El Paso, as you said. And when I asked you what your stance is today, how you identify today, you said a libertarian now, which just seems, I'm sure there's a lot of that in there. I'm wondering, I'm sure it's an interesting story of what leads you to identify with libertarianism? Let's say, what are the values, and what are the values or ideas about policy or what government should look like that attracted you to that end of the spectrum and away from what I'm sure was comfortable in what you knew, which was the Democrat left or leaning side of the spectrum. Can you talk about that a bit, please?
Yeah, absolutely. So, I remember going back to high school where I was very close to my history teacher, and she was very involved in, politics and teaching us about politics and things like that. Obviously, voting was one of the things that she felt was very important. But I do feel, and kind of looking back at it now, is that there isn't a, we're not really taught in a nonpartisan way when it comes to, US government or history and things like that in high school. And I don't know if it's changed because that was a very long time ago for me, but I feel like it was very one-sided. For example, looking back, I remember if there was a politician that was coming to speak to us at our school, it was typically always a Democrat. I mean, they never invited folks or speakers that kind of went against the fray, right? I mean, obviously there's a bunch of people that they may go off the rails a little bit and they're just too out there to bring them in front of students. But I always remember listening to a representative that was a Democrat. And so we never really got different perspectives on that. My family, they were Democrats. I mean, they always voted for Democrats. It didn't matter who they were. It didn't matter what their values were, what their stances were. They always voted for D's. And so I was like, okay, that kind of makes sense. Like, if my family is voting for this person, it must be for a good reason. And I never questioned that. I never said, well, why? Like, what are their stances? What do they believe in? Like, what are they doing? Just because that was also kind of frowned upon. Like, well, if your elders are saying to do this, then you should do it. Like, don't ask questions. And so that was kind of what I did. I just kind of went through the motions. And so when I was 18 and able to vote, I remember voting, at Montwood High School, and I was like, it was exciting because it was my first time to vote. But no one was like, Karla, remember, like, do your research, like, make sure that you're voting for someone that has the same values and stances and you do. It was more of, don't forget to vote for my cousin, Pancho or whatever, or, don't forget to vote for the Democrat or something like that. So, I mean, I never questioned it. And so, kind of shame on me for never really knowing the difference between both. That's just kind of how we grew up. As I got older, as I went to college, obviously I started learning different perspectives on that particular topic. My brother, he's worked in several campaigns. He worked in presidential campaigns. He actually was the main person kind of leading Senator McCain's campaign when he was running for president. And so the whole family was kind of like, he's a Republican, right? And so he was like, yeah, I know he's a Republican. And so I think that's when we became more involved in kind of the political process, was through him. Like, he saw it in a different light. For him, it was about, McCain's kind of like his history, like his stances, like his tenure being, a senator and all the great work he had done in Arizona. And so, we saw that. We didn't see that he was a Republican. We saw all the great things that he had been doing. And so, and we kind of learned that from my brother, which I thought was really cool. And I was like, wow, maybe I should kind of rethink this a little bit. And so, I mean, to be quite honest, I haven't been as involved in the political process or political or policy issues as much as I am now. And that's primarily because of LIBRE. And so, I came into this role kind of in a naive way because I didn't know a ton of stuff of what they were expecting in terms of, local, state, and federal policy. I knew about it and I read about it, but, by no means was I like a political expert on anything, on any policy. And so, I kind of got my experiences more from, being in the Peace Corps, kind of working in a country where, the government solution was to give their constituents everything they wanted. I mean, down to, I don't have money to buy a bag of rice. All right, here's the rice. Let me give you the rice. Like, don't worry about it. Instead of, teaching them, okay, let's work something out. Like, let's try and find you a job so you can work for the rice and things like that. Right. So, and then, learning from my brother, just kind of his stances on different policies and looking at in a different perspective. I was never really involved in that process, or, involved, but also never really paid attention much, I guess. And so I was able to help him with a couple of local campaigns, and I was like, wow, I said, I never want to be in politics. Like, I never want to be a politician. Like, this is not my cup of tea. And so that's kind of where it ended. And when I found Libre, it was more of a kind of well-rounded organization that we could empower the Hispanic community. We could teach them we could provide different tools and resources, but also teach them about policy in a nonpartisan way, which I thought was really great. And that's why I say, I feel like I'm more of a libertarian. Like, I'm not really a Republican or a Democrat. I mean, I would say that I consider myself like a fiscally conservative individual. Like, I don't think it's right to overspend money that we don't have, or continuing to tax people for beautification projects and things like that. I certainly don't agree with that. So I guess I'm still kind of sort of fighting myself, but I think with Libre, I'm exposed more to certain policy issues, and not necessarily, we're going to side with like this Republican or this Democrat, or, it's more of, well, are they doing the best for their constituents, for our country, like for, our communities? And so that's kind of how it all evolved for me, kind of going from a Democrat in high school and then learning everything to where I'm at now. So it certainly has been a process.
What was it about the campaign, or the campaign, I guess, style? What was it that made you say, I don't want any part of this?
I think part of it had to do with, I didn't feel prepared enough to talk about like a certain issue, right? So if we were doing an election for, like a local council person, and they're like, well, why do my property taxes keep going up? And I'm just kind of like, I'm not sure, sir. Let me look into that. And so, me being unprepared in that way, I think that was a little bit difficult. But also, running into people that just didn't want to engage with you in respects to government or politics or anything like that, saying, well, I don't vote because my vote doesn't count. It's kind of hard to respond to that. What do you say? When you're trying to engage someone on voting for someone, and that's their response. They're so, kind of like maybe jaded, like maybe they just had really bad experiences with elected officials, or how things are going in our communities, that they're just like, well, it's kind of pointless. Like, why get involved? But I think also the cutthroat part of it, where sides, and it's like this everywhere, obviously, and we saw a lot of that during Trump's presidency, where being able to respectfully engage with someone, I think that definitely has gone out the window. And that's not something that I want to engage in. That's not how I, engage with people, whether it's personally or professionally. Like, I don't want to engage with people like that, or be associated with someone or an organization, or anyone that would treat someone like that. And so I think that definitely turned me off to wanting to run for any kind of office, or be more engaged with political races.
So can you talk about what your work looked like before the pandemic, and what I imagine gearing up for 2020, before COVID was a thing? I imagine you had a lot of plans. You all had a lot of planning already in place for a very important year politically. I imagine it's sort of an uphill battle for you being in El Paso, to push anything, or to advocate for anything that is not, like you're saying, like straight Democrat voting. So I'm just wondering, how does that in particular, how do you deal with that aspect of it, being in such a heavily concentrated Democratic area, and just sort of, what did your work entail before the pandemic? What did your work look like?
Yeah, great question. So I've been in and out of El Paso since I graduated high school. I went to Denver and did my undergrad, and then was in the Springs, and then I did the Peace Corps for a few years, but I worked at the El Paso Times here. And so I definitely tried to stay connected with, some of my professional and personal friends here. And so that has really helped me build my community in terms of LIBRE. And so pre-pandemic, I was Monday through Saturday sometimes, like out in the community engaging, whether it was hosting an event at a high school or hosting a phone bank to call on a certain, policy or something. We always had things going on that were engaging our community, taking them out to Top Golf or kind of fun and fulfillment things where it wasn't about anything having to do with policy or work or anything. We just wanted to make sure that we were engaging with them like on a personal level. And so typically Monday through Sunday, there was something going on here in terms of LIBRE. And so it was probably, I would say it was like 70 to 80% of me being out in the community, like interacting and engaging with one of our partners or, anybody here that we are partnering with. And that's one of the reasons why I enjoyed this job. I love being around people. I love interacting with people. I enjoy kind of enlightening and teaching people different things. And so when COVID hit, all of those plans just kind of went out the window. We had to pivot, and figure out how we were going to continue to empower Hispanics, engage them in different ways, but try to do it virtually. Because in the beginning, nobody wanted to, it was like a ghost town. Like nobody wanted to do anything. Everything was through the phone or through Zoom or, Microsoft Teams. And so that was very difficult for me. Fortunately, you just have to kind of be innovative and be creative in how you're going to do your job, but do it from home. And so that was also kind of difficult because like I mentioned, my toddler was running around and I'm trying to have Zoom meetings and stuff like that. So that was interesting. But, trying to engage with my community or my volunteers or my partners electronically or virtually, it was definitely a shift for what we were trying to accomplish. And fortunately, we've been in El Paso for 6 years now. And so I've already established some really great partnerships with a local school district. And so we've been doing financial literacy workshops with their high school students for probably the past 5 years. And we've also done entrepreneurship workshops. And so the great thing about that curriculum is that, one, the teachers, they're so bought into it, like they think it's very beneficial for their students that they were, 100% on board to shifting it virtually and trying to figure out how we could continue to incorporate that curriculum, with their students, whether they were at home, we could still incorporate these workshops for them because it was extremely important. And so we figured out how to be able to do it digitally. So we provided the textbooks for the students. They could still see videos and things like that on Zoom. So in terms of working with the high schools in that way, I think that's what really helped is that we kind of already had that 5-year relationship established. And so it was very easy for us to kind of shift over to that. Some of the other things that were more difficult was, if I wanted to start a new partnership with someone, it was kind of impersonal to have a meeting like over the phone or through Zoom. It was, more people want to meet in person. They want to kind of see your face, like who you are and things like that. And so that was very difficult for me. We were certainly able to continue a lot of partnerships that we already had established because they already, trusted LIBRE and they trusted me. But in terms of trying to get new things going, I think that was a little bit more difficult in terms of what we're trying to do. Last year, it was obviously an election year. And so we were, calling people. We typically try to door knock and, talk to people about different legislation and things like that. Door knocking and going to people's homes, that was completely off the table for the first, 6 months. So we really had to figure out how we were going to continue everything. And then you throw digital into the mix in terms of, we want to make sure that we're connecting with our folks like through social media platforms. I'm certainly not a social media platform expert. And so, they really wanted us to up our game and, post more on Facebook and Instagram and Twitter and every other platform that you could probably think of. And so that was definitely a learning curve for me because, I do know about it because of my business background, but that wasn't my sole, focus in terms of my role here with Libre. So that was certainly a little bit difficult in trying to learn that platform a little bit more. And so I honestly cannot wait for things to get back to normal because I really enjoy working with the school districts and all our partners that we have in El Paso, and that I think it really has taken a toll on not only myself, but most people that are used to being out and interacting with people or even with students and things like that. So I'm hoping that changes soon.
Yeah, definitely. I bet. I imagine that nothing compares to that face-to-face interaction, the engaging like with people where they're at. But was you talking about these things that a lot of people have had to shift to using social media more, using digital more, Zoom. But anything in particular that you found to be really successful, like any pleasant surprises, like, oh, this is something that we wouldn't have tried, had it not been necessary due to the pandemic, and this is actually working out very well. And anything like that you think you will continue doing in the future?
Yes, I think with one of our goals is to engage with local, state and federal legislators. And so for me, surprisingly, like reaching out to local legislators has been somewhat of a learning curve for me as well, just because, sometimes when they hear Libre, they think of other things like, we're a Republican group, like we're a conservative group and things like that. And so for me to want to be able to change that messaging to say, listen, like we're a nonpartisan organization. My goal here in El Paso is really to empower the Hispanic community. And if we can, just because you're a Democrat or Republican, if we can come together and agree on, maybe one policy that we're championing, like immigration, obviously immigration here in El Paso, because we're a border town, a lot that resonates with a lot of people. There are certainly a lot of DACA recipients that live in El Paso and who certainly want a resolution for that. And so that was kind of my approach in terms of engaging our local legislators. What I really found that has worked is doing virtual town halls with them. And so, I invite them and I say, listen, would you participate in a virtual town hall with us? So we're going to do it live on Facebook. It's just 30 minutes. We just kind of want to ask you some questions about your work in El Paso and obviously at the Capitol, because Texas legislative session is going on right now. So we would ask them about certain bills that might affect El Paso or help El Paso. And so what I found is that it felt a little bit more comfortable doing it that way, where it was like a virtual town hall. And secondly, our reach was, it was limitless because it wasn't a physical town hall where, okay, we can only admit 100 people. It was a virtual town hall where anybody could watch it, and anybody could watch it at any time they wanted to. So just because they weren't able to log on during that time, that town hall was always going to be there for them to watch whenever they had, 30 minutes. And so I also think that it humanized me a little bit and our legislators, because it wasn't always like talking about business. Oh, can you talk to me about HB 749? It was like, what do you like to do on your spare time? Like, what does your wife do? Like, do you have kids? And so it was really a way for us to kind of humanize them, because I think that there are a lot of different perspectives on legislators, and we know the name, we know that they're Democrats, we know that they represent El Paso, but we don't always know who they are or what they stand for or what they're, fighting for in Austin and things like that. And so I think that was really instrumental to us continuing to engage with our LIBRE community. And so, I mean, we have, we have just a ton of content on our Facebook page where it's talking to legislators about, policy and themselves. And so that has been really instrumental to our work during COVID.
Have you found, or were you forced to change what you, sort of the services that y'all offered or the activities that you participated in directly as a result of COVID? Like, were there necessities suddenly that existed in the community that you saw an opportunity to engage with by responding to the, whether it be like, I don't know, like PPE equipment or information or just anything specifically related to the pandemic that y'all sort of jumped on or were able to incorporate into what you do?
Yeah, so with our partners, like if they, sometimes they need waters or something for an activity that they were having at their school, or I'm a huge believer and advocate for educators in terms that they're definitely overworked and underappreciated. And so because I work with a lot of educators and a lot of people in my family are educators, I try to make sure that I provide things that they may need, right? It can be something small, they could need lunch for a staff meeting or something. And I'm like, don't worry about it. Like, we'll get it delivered or something like that. But I think things like that, like engaging with them and letting them know that we're still there. We're still here for them, right? Like, LIBRE has not gone away. We still want to help you any way that we can. So just let me know what you all need. We still definitely help with some things like that. Or, if it was Teacher Appreciation Week and they were wanting to send lunch to like Teacher of the Day or week or whatever, we would try to sponsor things like that. So I definitely jumped on opportunities like that because I wanted to make sure that our community partners knew that we are still here. Like, LIBRE was not going to go away just because I can't see you in person, at your school twice a week doesn't mean that we're not here to help. And so we definitely try to do things like that for anyone. We also, there were some local businesses that were ready to shut down. And so we tried to promote them as much as we could, like on our Facebook page, or, we would also go and purchase food from them, like if it was for a large crowd or something. So anything that we could do to get involved in locally and also help folks locally, we certainly try to do that during this time. Because we know that a lot of people suffered a lot during this time. So many businesses have closed, people were laid off. And so anything that we could kind of ease the blow of that, we were definitely there to help if we could.
Yeah, so you talk about your working on empowering the Hispanic community is a phrase you've used a couple of times. And so I'm wondering what, the challenges of that are from the perspective of an organization like LIBRE, which you notice is nonpartisan, but it does, its mission and ideology do seem to align more with what would be traditionally, quote unquote, conservative values, right? And so I wonder, in majority Democrat, majority Latino El Paso, what messages have you found like really resonate with the communities that you work with? When you strip away the political sort of wrappings or whatever, what messages about either policies or just life in general have you found to be like, oh, these are like common threads that, that we can find in these communities?
Yeah, and that's a great question. And I always love talking about this because it's something that I'm extremely passionate about. One of the things, or kind of one of the, the ways that we've been able to engage more with the community here in El Paso, given all their political views and things like that, is by incorporating financial literacy workshops with many of the school districts and many of El Paso, community members. And so when I just started 6 years ago, they were kind of like, okay, here's the El Paso community. Like, you got to go out there and empower the Hispanic community. And I was like, okay, like, how do I do that? And so, we were already in other states. And so I was kind of learning what other states were doing. Some states were hosting English courses, because obviously that's a tool that helps Hispanics get a better job, maybe. There were folks in Nevada that were hosting driver's license courses, because, obviously if you have your driver's license, you can drive yourself to work. You don't have to do public transportation. I mean, obviously it opens a lot of opportunity for you, right? So I was like, okay, I mean, I really, those really aren't in my wheelhouse. Like, what am I going to do, right? So I was kind of researching things. And so I came across this gentleman. His name's Dave Ramsey. I'm not sure if you're familiar with him, but he's a financial guru, and his company is based out of Nashville, Tennessee. But essentially, his philosophy of financial literacy is completely different in terms of what I was taught when I was growing up. And so, we Hispanics, like, we come from another country to the US to have a better life. And we're like, once we have money in our pockets, we want to live like the Joneses, right? We want to have a nice car. We want to have a nice house. But what they don't realize is that, being in debt is not financial independence. Like, that's not the American dream. Like, that's not going to lead to the American dream. Like, I'm a huge believer in the American dream, and I think that it's still alive. But I think that the way that we are taught to live our lives financially, in terms of our personal finances, we're definitely being directed in the wrong way. And so when I was like, okay, how can we empower Hispanics? Like, what am I going to do? And I was like, wow, like, financial literacy is something that's different. Like, it's not something that probably a lot of people know about, right? They probably think that being financially independent is having a great credit score and living, paycheck to paycheck, and being in debt and all this and all that stuff, which is what I was taught. I mean, that's what my parents taught us, who were like, don't worry about it. We'll just put it on the credit card and everything will be great, And so I wanted to change that. Like, I wanted Hispanics, and I wanted young Hispanics to have a different perspective on what the American dream was, but also that you can be a millionaire. Like, it doesn't take, it's not what's the saying? He always says that it's not easy, but it's not simple either. Like, you just have to be intentional about what you want to do. And so that's one of the ways that I've been able to engage here in El Paso, is that I'm not interested in you voting for a Republican or a conservative or anything like that. I want to teach you all financial literacy. And so what we've been able to do is incorporate some things that relate politically to financial literacy. And one of the examples that we always use is the national debt clock. So most high school students aren't familiar with what that is, or where it comes from, or that even exists, right? So, we kind of talk about, well, the US, like, the US has national debt, and we kind of break it down and show them, this is how much the US is indebted to, whatever the case may be, whether it's student loans or whatever it is. And it just keeps going and going and going and going. And then by the end of the class period, we see how much it's increased in that 45-minute period, right? So we really try to connect the financial literacy to some of the other things that we're trying to teach within LIBRE, right? So, for example, what about student loans? Like, do you want to take out student loans? Which is what they've been taught, right? I was taught too. Like, I'm still paying my student loans, and they're like, don't worry about it. Just take out a bunch of student loans, and you can go to any school that you want. But, what they don't tell them is, listen, like, yes, you're going to take out $20,000 to go to this really great school that you want to go to. But did you know that the interest rate is, 23%? And did you know that by the time you finish paying your student loan, you're going to be paying the student loan for like the next 40 years? they really don't, they're not honest to you. They're not honest to us about what it really entails. And so, we've gotten really down to the basics in terms of, what if you stayed in El Paso, went to community college for a semester? If you wanted to pay that in cash, all you would need to do is get a summer job, save up the money, and you could pay your first semester at community college debt free. And it's like, wow, we didn't know that. Like, everyone keeps telling us we need to take out student loans, and we're like, no, there's a different way. Budgeting, like, we teach them about budgeting. We teach them how to read a paycheck stub. Most of them don't know that, they're like, well, what's this? What are these other fees that they're taking out of my paycheck? And we're like, well, that's, Social Security, like, that's, the government has to take their cut. And so it's really great life skills, but it's also a way for them, a different way for them to live their lives moving forward. And also, they have the ability, these are, 15, 16-year-olds, they have the ability to save money, to not be in debt, and, change their legacy for their families. You never know, right? Some kids, like, yes, it sinks in and they're like, wow, this is great. Like, I want to be a millionaire. Like, they get really inspired by it. And they're like, wow, we didn't know that. And some kids are like, no, I don't want to do that. Like, that's not for me. But there's also a really cool website that we use where I'm like, look, like, if you guys don't believe me, that's fine. But I'm going to show you this website, and you can plug in it, plug in the numbers and say, I want to be a millionaire by the time I'm 50 years old, and I'm going to save this much money. And once we do all the math, if you're anywhere from, like 16, 18 years old, you only have to save $85.50 per month until, for the next 40 years, and you'll have like $1.2 million. And they're like, they never believe me. They're like, that's not true. We don't believe you. And we're like, yes, let's look at the numbers. Like, let's plug them in. I'm like, this is not me. Like, this is an algorithm. This is math. Like, you can't, math doesn't lie. I said, I'm not showing you some fabrication here. And, they get really excited about it. And so, what we're seeing more and more is that the average retirement age is actually increasing because there are so many people that are still in debt. Before, people were like, I'm going to retire when I'm 50, or, now then it moved up to 55. And now actually the average retirement age is like 67. And I'm like, do you guys really want to be working when you're 67 years old? Like, you should be home with your grandkids, and it's like, but we're such a culture that it's like, we want it now. Like, we need to have the new car, we need to have the new house. Like, and so I think that that's something that is also part of what Libre's mission is that, yes, we want fiscally conservative people, but we also want people that are financially independent. We want people to be inspired to reach the American dream, and also, let them know that it's very much a possibility. Like, I think the statistics is like 70% of Americans live paycheck to paycheck. That's a ton of people that, they're living paycheck to paycheck in the US. And now that I've been teaching it for so long, and I'm kind of learning with them as well, it really has inspired me too, like, just within my family, for us to change like our financial habits and be more intentional about, well, do we really need that? Probably not. Let's just not buy that. And so, because I want to change my family's legacy. Like, I want my kids, like, I want my family to say, wow, we did it. Like, we're millionaires. And that's kind of how we've been able to incorporate our Libre messaging with financial literacy and get more people on board in El Paso and say, yeah, that is really needed in El Paso. Like, more people should learn about financial literacy. And so that's been my way to be able to connect with people here, not only in a professional way, but also, we've had a lot of educators that are like, this is great information. Like, I never knew about this. And so, it really opens up the door more for us to kind of expand the program, because then they're telling another educator or, a principal and saying, we really should do this with Libre. Like, it's been really great for our students.
Yeah, that sounds really cool. Hopefully there'll be a whole generation of Hispanic millionaires that have you to
We're
thank
hoping.
years down the line. That's really cool. Well, I really only have one more question for you, Karla, and it's sort of related to this, but you know, when you look at the future of your work with Libre, or wherever you'll be in the future, but the work that you've been doing, and also just, you know, your personal life, we're reaching the end of a very strange time period, right? People are getting vaccinated, things are slowly returning to normal. Just sort of, what are you focused on? What are the priorities that you have on the horizon, just over the next couple of years?
So I definitely think it's going to take all of us some time to feel like some sense of normalcy. And I'm hoping that, you know, that happens soon for a lot of people. I mean, myself included. Obviously there's been a lot of deterioration in mental health and things like that, just because, you know, it is something that's very different for people to try and handle, and especially to try and handle on their own, because many of us have not been able to be with loved ones, or, you know, just kind of have that bond that you have with your family like you normally do, because you can't be with them. So that's really my goal in terms of like my personal life, is like I'm really hoping that things get back to normal, and that my family and friends aren't, you know, as affected by this, and that, you know, we can get back to how things were before at some point. In terms of my professional career with Libre, I'm hoping that we kind of hit the ground running when they're like, all right, guys, schools are opening back up, you can come back. Like, I can't wait for that. Because typically I would probably spend 2 to 3 days like in at least a school, kind of interacting with educators and students and things like that with the work that I've been doing, or even our volunteers and activists. I mean, like I mentioned earlier, we always had something going on with them, and that has been, I think it's hindered us a little bit in terms of our reach with Libre and how we're trying to interact with them. It's, you know, it's been very limited. So I'm hoping that we continue to grow over the next couple of years. I know that we are growing in terms of trying to be in more states with Libre, and with where the Hispanic population is growing. I mean, and it's kind of growing everywhere. So we have to pick and choose where is the best, you know, place to be, and where the opportunity is to ensure that we're empowering and engaging with Hispanics and kind of helping them in any way we can. So that, I mean, that's kind of my kind of 2-year goal. I don't think that things will get back to normal until like 2022, in terms of, you know, the mask wearing and people's concern on who's vaccinated and who isn't, and things like that. I've already fortunately been able to travel. I traveled, you know, to Dallas and to Orlando this month, and so it was definitely interesting. It was different, but you know, despite the mask and all that stuff, I still enjoyed being out there and kind of interacting with people. And so that's kind of my hope, and kind of my goal for the next couple of years is just to continue my work here in El Paso, and, you know, change people's perspectives on who we are, and just continue to provide tools and resources for our folks here any way that we can.
Well, I'm sure it could continue to go well. Yeah, just best of luck with that. Thank you, Karla, for giving us your time and your perspective. It's really valuable. We appreciate it, and just happy to have your voice in the project.
Of course, thank you. Thank you so much for the opportunity, and anything else I can do to help, please let me know.
Of course, thank you.
Thank you.